Yeah. Hello and welcome to the Far Northern Regional Center Supporting Client Health and Wellness class. I'm really happy everybody joined us today. This is a great topic, infection control. It was one of the top things that was requested by providers for training. So we've gone ahead and put one together for today. And hopefully we will cover anything that you have questions about. But if you do have a question as we go through the class, feel free to type that in the chat, and we'll keep an eye on it so we can answer your questions. Or if we're having discussion, you can unmute, but we do ask that you go ahead and stay muted during the class just to limit the feedback. So I will introduce also another member of our clinical team who is here today, and that is Nellie Camarena. She's our nurse from the Chico office.
Hi, everyone. Welcome.
My name is Jen Badger, and I am one of the nurses in the Reading office. So let's go ahead and we'll get started. So for today's agenda, we're going to talk.
It's in that. It's on top of the fire.
Let's try and figure out who's unmuted. There you go. Okay. Sorry about that, you guys. So we'll just talk a little briefly about viruses, bacteria, and fungi, and then we're going to really go into the meat of the class today, talking about standard precautions, something that hopefully you all are familiar with, and then a little bit on airborne precautions and the non-emergency standards, just some excerpts from that from Cal Lucia. So viruses, bacteria, and fungi, these are microscopic or submicroscopic infectious agents, organisms, and viruses, they are different. They're smaller than bacteria, and they also have to live inside of another organism. They don't survive very long, usually outside of a host. Whereas bacteria, whereas bacteria are single cell organisms that are really all over the place. And many bacteria are really good for people, right? Like, we all hear a lot about microbiome and healthy bacteria and balance and stuff, because the bacteria, they are all over the place. So, really the goal is to have the kind of bacteria that are beneficial to you and not the bacteria that can cause illness and disease. And fungi, those are also living organisms. Included in that group is like yeast or candida, which I'm sure you've all heard of. And these fungi, though, they actually spread through spores or like seeds that go out into the environment or on the individual who's infected. And then they can come into contact with others and spread that way. And even though we don't see them, we do have to really always be cognizant that germs are everywhere. And usually when they're spread from one person to another, it's because you've physically contacted them or touched them and then, touched your eyes or your nose or your mouth and gotten it that way. And however, there are certain viruses and bacteria and even spores that can be airborne. And we'll talk more about that. So I don't know, I thought these stats were interesting, but the average adult has about 1,000 different species of bacteria living on their skin. And the large intestine, which of course has your fecal material in it, and we know that that's full of bacteria, right? But I mean, from what I understand, there are billions of bacteria that live in your large intestine. In your mouth, there's only about 50 to 100 billion bacteria living in the mouth. And your hands even are carrying millions of bacteria that can be spread to other people. And I think when I read about like the mouth, I'm thinking of when we're doing oral care or, when you think about the large intestine, we think about helping people with toileting and just how much bacteria is really present during those activities and what we have to watch out for. And interestingly as well, some of these organisms can live only for a short time, like a few minutes out in the environment if they're not on a host. And there's other ones that can last for years, which is really just kind of scary, to be honest. And you guys can research that if you want, but it's pretty fun to see what's really cool. So let's talk about standard precautions. Standard precautions are intended to be applied to the care of all clients in all settings. It's standard, right? It's the norm. And this is regardless of if you suspect or confirm the presence of an infection of any kind. Implementation of standard precautions is the primary strategy for the prevention of transmission of infectious agents from among clients and their care staff. And standard precautions are based on the principle that all blood, body fluids, secretions, excretions, except for sweat, interestingly, non-intact skin and mucous membranes can or may contain transmissible infectious agents. So the idea is that basically everything is dirty, if you will. So standard precautions include a group of prevention practices that really apply to everybody. And these are going to include hand hygiene, personal protective equipment, such as gloves, gowns, masks, eye protection, depending on what the anticipated exposure is. Also, any equipment items in the client's environment that are likely to have been contaminated with infectious body fluids, they need to be handled in a manner that prevents transmission of those infectious agents, such as like wearing gloves for direct contact or when you're working with heavily soiled equipment, and then proper cleaning and disinfecting of reusable. So, and we're going to go into each one of these individually. By the way, this last one was actually just added during the pandemic, and that's the respiratory hygiene and cough etiquette. And I think, it seems like kind of a pretty simple thing, right? That I think we maybe just assumed everybody already knows this. They already do practice it, but they have added it to the standard precautions because I think what we found, especially during COVID, is that not everyone does know or is aware of how important it is to practice respiratory hygiene and etiquette. So we'll talk more about that as we go through each one. So your hands, so that's going to be washing, sanitizing, or gloving, and gloving, excuse me. And this is really the most important step you can take to prevent the spread of infection is washing your hands. And you should wash for, I think some people say you sing the happy birthday song or sing jingle bells or, whatever the case, but it should be about 20 to 30 seconds. And just 15 seconds of washing your hands, it gets rid of almost 90% of the bacteria that's on your hands. And then if you continue for that additional 15 seconds, 99.9% of bacteria is washed away. And I mean, it's a highly effective way of getting rid of the germs on your hands. And that's why it is considered the most important step. It reduces the risk of spreading those germs to other people, and it reduces the risk as well of colonization or infection of care staff from clients. And you know, we don't want to have those any nasty bugs that are living on our hands long term, right? Because once bacteria gets on your skin, it's very difficult to completely eradicate that particular bug. And so we want to make sure that we are washing our hands frequently. So when do we wash our hands? Immediately before or after touching a client or the client's surroundings, if they're not clean, especially. Before and after assisting with medications, because you're going to likely come in contact with medications with your hands, and then you're going to be giving those to the client to ingest through their mouth. And so we don't want germs going into their mouth. And also afterwards, because you don't want medication residue on your hands, and you've been working with a client, right? So we want to make sure that we're washing your hands before and after. After any contact with blood or body fluids or other potentially infectious material or contaminated surfaces. You always want to use hand sanitizer or wash your hands immediately before you put your gloves on and immediately after you take your gloves off. Anytime your hands are visibly soiled, if there's, you know, if you can see something on your hands that needs washed off, then you should wash your hands. And that includes if you can feel like, you know, stickiness or something, wash your hands, because you really don't always know what's on it. Before and after handling, preparing, or eating food. Very important. You know, we want to make sure that the foods that we're preparing, whether it's for ourselves or for others, is clean and we're not passing along germs that way. And before moving from work on a soiled body site to a clean body site on the same client. And this one's really important. And I think this is probably the one that gets missed the most, right? Because you're in the middle of working with someone. But if you are helping them with toileting, you know, you should be washing your hands before you assist them with oral care. We can make it simple like that. But you know, the idea is that if somebody has infectious microbes that are on a certain area of their body, we don't want to put them somewhere they don't belong, right? And anytime you use the restroom, you should always wash your hands. Always. It really amazes me how many people do not wash their hands after using the restroom. So the other option that we have is when to use alcohol-based hand sanitizer. So the reality is that unless your hands are visibly soiled, alcohol-based hand sanitizer is actually preferred over soap and water in most clinical type situations, caregiving situations, because the alcohol is more effective at killing germs on your hands than soap is. Soap is essentially going to be washing the germs away with the water. Whereas the alcohol in the hand sanitizer is actually going to kill those germs. It's easier to use when providing care. So like, especially when you're moving from a soiled to clean activity with the same client, right? It's a lot easier to use hand sanitizer than to stop what you're doing and go to where there's a sink and wash your hands. And it results in improved skin condition with less irritation and dryness than soap and water, which I thought was really surprising because you would think alcohol is very drying. of the hands, but soap can be very drying as well. And it improves hand hygiene adherence, simply because it is easier to use more frequently. So we just get better hand hygiene when we have hand sanitizer throughout the facility for people. So if that's when we wash hands and when we use sanitizer, when do we wear gloves? So anytime you anticipate that you're going to come in contact with blood or other infectious material, mucous membranes, which is, you know, the eyes, the nose, the mouth, the peri area, any non-intact skin, any potentially contaminated skin, or any contaminated equipment, you want to put some gloves on. And also, if you have an intact skin or a wound or rash or something on your hand, you should definitely be wearing gloves. And this is, you know, to protect you from the germs that you may come in contact. And then when it's needed for transmission-based precautions, such as when somebody is in quarantine or isolation. It's important that we remember that gloves are not a substitute for hand hygiene. They're really supposed to be used together. If your task requires gloves, then you would want to perform hand hygiene immediately before donning your gloves and touching the patient or the client or their surroundings, and then always clean them after. And remember to remove your gloves carefully so that you don't get whatever's on the gloves onto your hands, because that defeats the purpose, right? You know, so there is a way to remove gloves so that you don't come in contact with the outside of the glove. There are lots of videos on YouTube that can be viewed on how to don and doff gloves and PPE, and I do recommend that people watch the videos and the techniques for doing that, and you know, practice it and just get in the habit of removing, donning and doffing stuff. So when do we want to change our gloves and clean our hands? Like if you're in the middle of working with someone and your glove is torn, which, you know, it can happen, especially if you have big hands, if you have long nails, if you have jewelry, lots of rings, those kinds of things can all contribute to damaged gloves. And so you need to take them off, wash your hands, put on gloves. If they become soiled with blood or body fluids, take them off, toss them, wash your hands. If you're moving again from soiled body site to clean body site, and if you're moving from care on one client to another client, putting gloves on, you know, you're going to be protected. But then if you move from one client to another, you're just passing the germs between the clients. Anytime your gloves look dirty or they have blood or body fluids on them, you know, we want to get rid of the gloves, wash our hands. And as part of doffing PPE before you exit the room, when somebody is in their room in isolation, quarantine, or you've been working with them and you have your gloves on, go ahead and, you know, you want to toss those in the trash before you leave the room so that you don't risk contaminating things on your way to wherever you're heading. So personal protective equipment. We all learned a lot about PPE during the pandemic, probably a lot more than we wanted to know, right? But we got really, I think, pretty good at using a lot of this stuff. So gowns are generally used during procedures where client care activities are going to involve contact of your clothing or your body against that person or your exposed skin. against that person's blood, body fluids, secretions, or excretions. So, anything where you want to protect your body from that contact. Because once it gets on your clothes, it's on your clothes, right? And so unless you have extra clothes at work, your clothes are gonna be contaminated. So that's where gowns are very, very helpful, especially like with incontinence care, repositioning in bed, transfers where you have to, get close and lift someone next to you or against your body. That's where gloves come in really useful. And then we have masks and face shields. And these need to be used during procedures or client care activities that are likely to generate splashes or sprays of blood, body fluids, secretions. This is especially true of like suctioning, also during any aerosol generating procedures. And aerosol generating procedures like a nebulizer treatment, use of a CPAP machine. Those things can aerosolize the germs into the air, and we want to make sure that we're protecting ourselves by wearing a mask and a face shield. Or if there's proven infections that are transmitted by aerosols, then of course we would want to step it up and wear a fitted N95 in addition to gloves, gown, and face and eye protection. We're going to talk more about that when we talk about airborne precautions. And then lastly, gloves. Again, anytime you're going to likely come into contact with blood or body fluids, or contaminated surfaces, skin, etc. So the next one is soiled equipment. We want to make sure that we're handling any equipment that's been used in a way that's going to prevent transferring microorganisms to others. So, we don't want to be swinging stuff around and, touching everything with it, setting it on the bed or moving, we want to be cognizant of the fact that equipment has stuff on it. I mean, it gets dirty, right? So it's super important that when we're working with equipment that's dirty or that's been used, we want to make sure we're wearing gloves, and we want to sanitize equipment between clients so that we're not spreading germs from client to client. If you have if you're using a Hoyer lift in your facility and you use the same Hoyer lift for more than one client, it needs to be wiped down before you put someone else into that sling. Slings go like around the legs and the bottom and everywhere, right? So it's kind of gross when you think about it. So it's super important that we're wiping stuff down, we're cleaning it with sanitizer, and making sure that we're not spreading those germs. And then, of course, anytime you've been working with equipment that's been used, we want to make sure we're using hand hygiene before we move on to the next task. Cleaning and disinfection. So regularly cleaning surfaces in the facility is going to help prevent the spread of germs that make people sick. And this means that you need to have procedures for routine care and cleaning and disinfection of environmental surfaces, especially any surfaces that are frequently touched in client care areas. And these procedures should be part of every facility's infection control program. And I know I keep saying facility, but if we have anybody here who's works in ILS or SLS, it's best practice to do this at people's homes where you're providing care as well, right? We want to make sure that we're that we're cleaning routinely. And the best practice is to clean surfaces with soap and water first to get that visible or surface germs off, and then use your EPA registered disinfectant. Not all disinfectants work on all germs, and actually, if you read the labels, a lot of times it'll list out what it's effective on, and it may even tell you what it's not effective on. So make sure that the disinfectant you're using is safe for the surface you're disinfecting as well. If you have like laminate or hardwood, you may not be able to use the same products. But we want to make sure we're cleaning all of those surfaces, right? Because those germs, they get stirred up in the air, or if people are sick, they may be breathing them out, and eventually those germs settle, and they settle on all the surfaces that are around us: floors, chairs, counters, tables, walls, and window coverings. All those things that, some of them are obvious, right? Cleaning a toilet or a bathroom. I mean, we know we have to clean those. They usually look like they need clean when they need it. And we want to wipe that stuff down. But, at least I don't know that there's any kind of rule about time frame, but I would think at least weekly we would be doing kind of a full house clean. And getting some of that stuff that's maybe, on the floor or splattered on the wall, that. And then don't forget your high touch items, pens that, a lot of times when I go into homes, there's, the MAR might be sitting there and have a pen sitting there, and more than one person is grabbing that pen and using it. So, you can wipe pens down, any handles that are on things, stair rails, restroom fixtures, all of that stuff. And then, of course, any spills of blood or potentially infectious materials, we want to clean that up promptly and disinfect once we've gotten the actual visible stuff off. Soft surfaces can be a challenge. Couches, rugs, things that hopefully some things can be laundered and that will sterilize or clean them. But you can clean most soft surfaces with soap and water. And then, periodically having like carpets cleaned and furniture cleaned, that sort of thing. So the next part of standard precautions is textiles and laundry. So you should always wear reusable gloves when you're handling soiled laundry. And I know it says rubber on this slide for gloves, but non-latex is usually what people are using, nitrile. But, you should have gloves on. You really don't know what's been on that laundry. And, so go ahead and wear your gloves, and then you can change them out like between client rooms. If you're working on one person's stuff, you could probably do all that and then take them off, wash your hands, and then don new gloves till you move to the next room. And then wash your hands, of course, after handling soiled laundry, and definitely before handling clean laundry, because we don't want to put germs on the clean laundry and then go put it on our clients. So handle your laundry with some care. You want to avoid shaking stuff off or agitating it in any way that could, put dust and aerosolized germs into the air or around you. It's best if if something has some stuff all over it, like that you need to get off of it before you wash it, it's best to take it outside and be very gentle about it, so you're not, fluffing that stuff into your face. it's good idea to use a container, like having, use hampers or some other large tub or something when you're carrying laundry, like from the bedroom to the laundry area. You shouldn't be holding a big pile of blankets up against your body that have come off of a client's bed that need washed. Those are dirty, and you're just getting those germs all over the front of you. So having a good container to use when moving laundry or soiled fabrics around is a good idea. And you should wash any heavily soiled laundry by itself. It's a good idea to use an extra rinse just to make sure that you're getting all of that stuff off of there. If you have the option of adding bleach to laundry, it's a great idea. Obviously, with colors, it could be dangerous if you get to the design or coloring on the fabrics, but I think bleach is a great way of killing germs. And then using the correct temperature. So there are temperature maximum settings for facilities through, regulation. But when you're doing laundry, you want to go ahead and use the hottest temperature that you're able to use. Usually you can't set a time. So, just making sure that you're like turning the laundry to heavy duty and hot. And that way it's going to kill and wash away the majority, if not all, germs. And then bleach, of course, as I mentioned. You can also add a mild acid to neutralize alkalinity in the water with a soap or detergent, and this will improve the sanitizing effect of washing laundry. And then storing your clean linens. They should be in a clean area, preferably enclosed so that, while like folded blankets and towels and things are sitting, they're not getting dust and other contaminants on them. So having a place where you can keep your linens and maintain them clean is a great idea. So safe injections and sharps disposal are also part of standard precautions. And while I understand that staff is not going to be, unless you're a nurse, is not going to be administering injections, we still are, the ones working with the client and assisting them. So we won't need to know. We need to know how to properly handle sharps. Some syringes are built with a safety device that actually you can pop over. It covers the needle so that there's reduces the risk of getting poked in the process of going between the client and the sharps container. But not everybody has that option. So, if you don't have safety needles or clients using, maybe they're on insulin or some other type of injection, and they don't have a safety device, then you want to make sure that you aren't like walking through the house with a needle that's just pointing out there, right? It's best to take the sharps container to the client when they're using the needle, and then they can put it directly into the sharps container so that you're not walking. Needles should never be reused. Anytime that a needle punctures the skin, it's now contaminated. And this includes like blood sugar check needles. I know out in the community, some people will use those repeatedly until they get dull, and then they'll swap them out. But we really supposed to be doing that. They should be using a clean, fresh needle each time that they check their blood sugar. Always use a sharps container, and this should be a container that doesn't leak. It's not easily, punctured. And typically they are red or they have some kind of a label on them that they contain biohazards. Every home should have a sharps container. Just really on the off chance even that you end up having sharps that need to be disposed of. And this can include, it does not always just needles. I mean, sharps includes any broken glass or, broken plastic, anything that's going to potentially hurt somebody because it's sharp. And we want to make sure that those are disposed of correctly in the sharps container and that we are discarding that sharps container when it's 2/3 full or there's a little line on the container, but we don't want to let that get too full. They usually have like a little flip lid where when you put the needle in, you flip the thing and then the needle goes into the container. This is to prevent people from being able to reach into the container with their hands and get poked. But those little flip tops don't work when it's got too much stuff in it. So we just want to make sure that we're going ahead and discarding that appropriately. And there are locations where you can discard sharps containers throughout the community. Usually if you go to your city's city page or like here, I think the transfer station, if you go there online, you can find a list of locations. And then using single-use items is going to also help with infection control because again, the item's only being used once and then it's going into the sharps container. And then you should never, ever, 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 ever have more than one client use the same needle or syringe ever. Just don't ever do it. Because that's how we pass along bloodborne diseases, right? And then wash up. So if you come into contact, with any blood containing fluids, wash or disinfect the area, wash your hands or wherever you came in contact with something that's sharp or contaminated. You want to just scrub that with soap and water right away and, get it as clean as you can. And then we have waste management. So, sorry, I lost my spot here on my notes. So as far as waste management, I found the Title 22 regulations regarding solid waste. And it's really supposed to be handled in a way that's not going to be transmitting any diseases. You shouldn't have foul odors, shouldn't be a nuisance, like overflowing trash cans, and or a place, where it's going to be a breeding place for insects or rodents, or disease. So I know that if you have a facility where you're utilizing city bins for your garbage and you're finding that you are filling those up earlier than pickup is, then it's a good idea to call and see if you can get additional trash bins. And any container for trash needs to be, and this is if small trash containers in the house, this is also the big bins outside, right? They need to have tight fitting covers. And they need to be in good repair. There shouldn't be any holes or leaks. Fluids or wet things that are put in there can leak out onto the ground. Any solid waste containers also should be emptied at least once per week. So it's important to make sure you have kind of some kind of a reminder or schedule for staff to pull the cans out to the street for pickup. if for some reason it gets forgotten, you can call, and for a very small price, they will come out and pick it up on an off day when you don't normally have pickup. But we don't want a bunch of waste, especially biohazardous waste, just sitting out, in the trash or at the house for a long time, because that, of course, is just growing all kinds of germs. And then you want to make sure that you have the ability to clean your trash bins. And this, I think, is especially important inside of the house. You want to keep your trash bins clean on the outside. Any part of the lid that may come into contact with human hands, or out the outside of the bin that may come in contact with individuals living there, we want to make sure that we're wiping that down when we're doing our cleaning and disinfection, and trying to keep our homes as clean and sanitary as possible. You should always wear gloves when handling any bio waste or trash. And trash bins need to be throughout the facility. Ideally we'll have a trash in every client's room. If you work in residential, if you're in running a day program, we want to have trash bins available throughout the facility. So it's easy to throw things away, and you're not carrying germs through the facility by all clients when you're heading towards the one trash can, right? So also with any biohazard waste, such as feces, urine, vomit, blood, really, you may consider double bagging, tying the bags pretty tight, make sure that, it can't leak. And then when practical, take that bagged biohazard waste to the outside garbage bin as soon as possible, rather than putting it into the waste bin that's in the room. And when I say that, I don't mean like carrying soiled diapers through the house to throw them outside. We want to bag that stuff up and then take it outside so that we're not contaminating everything. But not leaving it sitting in the house is going to help with the odor of your homes or facilities, and it's also going to be a lot more comfortable for clients, not having that stuff laying in their rooms. So make sure that you wash your hands right after you've handled any trash or waste, and having someone who's assigned to take those bins out to the street every week. And then that last one, respiratory hygiene etiquette. So cough etiquette is a set of practices that help reduce the spread of respiratory illness. And basically, you should be covering your mouth and your nose, and throwing away any tissues that you use. Make sure that you're washing your hands anytime that you have sneezed or coughed into your elbow or hand. We want to make sure we're washing up, right? If you cough into your elbow, you might want to get up there and scrub, in the elbow area. We just want to really reduce the chance of spreading infection. And then part of respiratory hygiene is wearing a mask. If you have a bad cough and you're coughing frequently, and you have had or may have anything that is contagious, you should be wearing a mask. And that's going to keep germs from flying out towards other people in the room, or from aerosolized bacteria or viruses lingering in the air as well. So masks are not perfect, but they do catch a lot of germs and droplets that may be coming out of your mouth and stay away from others. If you're sick, just don't go around other people and get them sick too. You know, we're all trying to stay healthy, and our clients in particular are very tend to be very susceptible to illness, and so we want to make sure that we're doing whatever we can to protect them. So let's talk a little bit about airborne precautions. This is going to be a super short section. You know, we learned a lot with COVID about the difference between basic contact and standard precautions and airborne precautions. I very vividly remember when all of a sudden, oh no, it's airborne. Well, you know, we kind of knew that, but it really does change the level of protection and alertness to the situation that needs to be had by our staff and our clients. You know, so we want to make sure that we're isolating the person who is sick, that they're getting treatment so that we can hopefully get them better and they're not contagious anymore. We're going to ask those folks to wear a cloth or surgical mask to catch a lot of those germs before they spread out to everybody else, and practice good cough etiquette. And while I realize that some of our clients are not going to be able to wear a mask, a lot of our clients can. So we just want to, you know, ask people if they're coughing, they've been sick, to put a mask on. As you can see in this picture, you know, this source person has coughed and there are all those microbes in the air. And one of the things we can do to prevent those germs from getting to the receptor, or, you know, any of us or other clients, is by increasing ventilation. If you open windows, it's surprising, you can open a window a very small amount and actually get quite a lot of airflow in a room. And it helps significantly to reduce the number of microbes that are floating around, particularly if you have people in your homes or facilities who are sick. Consider air filtration, like with a HEPA filter or you know, some kind of filtration unit to help clear the air better and get that stuff out. And then UV germicidal radiation is on this picture, but I don't think that's really something that that you guys are probably looking at, but it is a thing. So again, you know, our receiving person here, this is our staff or our other clients, they're going to avoid getting sick by, you know, physical distancing and then the use of personal protective equipment. So respiratory protection is super important when you're talking about airborne disease. But when is it time to get out the N95 masks? Well, we just need to keep in mind that N95 respirators offer the best protection against respiratory airborne illnesses. And they're going to be filtering that air way more efficiently than like a surgical mask, because the air isn't going around the mask at all. It's got to go through the fibers to get to you. So when you're breathing, every time you're breathing in and out, it's filtering that air. You can tell an N95 from, say, a KN95 because they actually have two straps, a top and bottom head strap. They fit quite a bit differently. They're pretty snug on your face, or they should be. But that's how you can really tell the difference, other than, you know, they do have it printed on them. But if it has the top bottom straps versus the little ear loops, you're gonna get a better fit. Adults should choose an N95 respirator that's been professionally fit tested. There are a lot of different brands and a lot of different styles, and there's a lot of different people with a lot of different facial features. And so masks fit different people differently. You can go to most clinics, not all clinics, but most like walk-in clinics offer fit testing. And you can have that done there and determine exactly which brand of mask fits you the best. And then you can be better prepared when you need to wear an N95. A KN95 and a KF94 are also respirators, and internationally they're accepted, but they don't provide the same level of protection as an N95. And the main reason is because they're using the ear loops, and so they're not going to fit snug against your face. So you're going to have air that gets around the edges. And so that's just something to keep in mind. And then source control, as we talked about, whether you're the one who's been ill or is ill, or the client, or even a visitor or family member, we want to encourage source control if somebody is ill, or especially if they are coughing, sneezing, runny nose, just to catch those germs. They're not perfect. They don't catch all of them, but they do catch a lot, and they do help reduce the bacterial or viral load in the environment. So here's a classic picture that shows the transmission probability of someone who has COVID-19, who's not wearing a mask, and a healthy person without a mask. Transmission probability is high. With a mask on the person who has COVID, it's going to be lower. And if both individuals are wearing masks, it's going to be the lowest. I didn't add it to this slideshow, but you guys probably, I'm sure, remember the Swiss cheese picture. And, you're adding layers of protection with each step. So I did want to talk about CCL's PIN 2404 for adult and senior care. This came out recently, and essentially it provides some new recommendations that kind of broadens the whole infection control measures to not only include COVID-19, but also other airborne viruses that, can wreak havoc, like the flu or RSV. There's updated masking guidance in the PIN. One of the things also was it removed COVID-19 specific screening, isolation testing, and visitation guidance. And again, put it kind of under this respiratory virus umbrella. Because we do need to recognize that COVID-19 is not the only thing out there. We've always had flu. RSV has really made a comeback the last couple of years. I mean, it's been really affecting a lot of people. And so we want to make sure that we're capturing all of those threats. The PIN also references some new CDPH resources. There's the respiratory virus page. There's information on when and why to wear a mask, and how to get tested for COVID. I do also want to mention that Cal OSHA's COVID-19 prevention non-emergency standards are still in effect until February 3rd of 2025. And we're going to go over those on the next couple of slides. The licensees need to continue to follow adult and senior care infection control regulations. And they should update their infection control plan based on those recommendations. It's been, a couple years now since those infection control plans were required to be submitted. excuse me, I had to get a drink, to CCL. And those are plans that need to be updated as the guidance changes. So if you are an administrator or a licensee, please pull your infection control plans out and compare to the newest recommendations so that you can adjust as needed. So the CalOSHA non-emergency standards state that licensees need to be, or employers need to be investigating and responding to COVID-19 cases in the workplace. And what they've stated is that, these are the important steps. We want to make sure that we're figuring out, when was this person last at work? And then, when did they test? When did they have symptoms? Because of course, we know that's how we figure out when they can, when they're good to go and better and can come back. So we want to make sure we're determining which employees may have been exposed to that person through close contact, or maybe you have staff who are exposed through personal contacts at home or the community. We want to make testing available to employees with a close contact at no cost and during work hours. And this is with the exception of asymptomatic employees who recently recovered from COVID, right? Because we know there's some immunity there, so we don't need to worry about those folks. But anybody else who's been exposed, the employer is responsible for making COVID-19 testing available, and it needs to be done during work hours so that you're not using your personal time or taking sick leave, vacation leave to go get tested for COVID. And then excluding those COVID-19 cases during their infectious period from the workplace and implementing policies to prevent transmission after close contact. And those are all those things that we've used to do, sanitizing, disinfecting, masking, all of that stuff. So those are the main things that employers need to be doing when there is a COVID-19 case work. So, but what is the infectious period? We've seen these timelines change a lot as COVID has changed, right? We've got, it keeps switching to different variants, and they, I think the infectious period has gotten so much shorter than it was initially, and even the incubation period. So as of January 9th of this year, CDPH adopted this definition of infectious period, and this is what applies currently. So for COVID cases with symptoms, it's a minimum of 24 hours from the day of symptom onset. COVID cases can return if 24 hours have passed with no fever, without the use of, Tylenol, ibuprofen, and their symptoms are mild and improving. Or for COVID-19 cases where they don't have any symptoms, there is no infectious period for the purpose of isolation or exclusion from work. But if symptoms develop, then they fall under the criteria above. So I find this super interesting. And I guess what I want to say is that this is CalOSHA's minimum standard for employers. This does not necessarily mean that it's what you have in your infection control plan or your policies. You may choose to take a more conservative and cautious stance, particularly if you work with clients who are even higher risk than just our average clients, right? We know that people with developmental disabilities are at a higher risk for severe disease with any of these respiratory illnesses. So it may be, depending on the clients that you work with, the policy may be but it cannot be any less than what is being by Cal OSHA. So outbreaks, according to Cal OSHA, an outbreak is defined as 3 or more COVID-19 cases among employees in an exposed group within a 7-day period. And this is not necessarily going to apply to everyone. I apologize. I didn't really dig into CDPH's all facility letters for ICFs. I don't know if we have anyone from ICFs here today. But this wouldn't necessarily apply to you. But again, you know, you may want to go into full outbreak mode if you have one COVID-19 case among an employee or a client. So, you know, they're leaving a lot of it to your discretion. So I just wanted to let you know that this is what Cal OSHA defines an outbreak as. And we're going to exclude those COVID-19 positive cases during their infectious period and immediately make testing available. And then you can see here, it gives you kind of the cadence for testing. And when the excluded employee returns, they need to wear a mask for the total of 10 days from when their symptoms started. Asymptomatic employees who refuse to test are not excluded from work, but must wear a face covering for 10 days from the date of the most recent close contact. And then we're going to be definitely wanting to implement those ventilation changes and look at HEPA filters and other ways of reducing the risk to other clients and staff who are around individuals who have COVID or another respiratory illness. And all employees in the exposed group, regardless of vaccination status, need to wear face coverings when indoors or when outdoors and less than 6 feet from another person, unless there is an exception. And we know that, you know, a lot of our clients are not going to be able to tolerate wearing a mask, and we understand that. And, you know, that may apply to some employees as well. So we just want to, you know, remember that we have a duty to protect clients, staff, ourselves, and our community. And one of the ways we do this is by having policies and procedures related to infection control. We have a solid infection control plan. We know that we have PPE that's available for use at any moment. We want to make sure we have that stuff stored at our facilities. It's ready to go, and that we know where to get more if we need it. We want to implement those environmental safety measures of cleaning and disinfection and ventilation, and make sure that we're training up our staff, we're providing education, there's good communication between staff from shift to shift or from management to DSPs, and then a prompt and appropriate response to anybody who has symptoms, who's been exposed, or who's positive. And I emphasized for any infectious disease, we want to make sure we have all of these things in place. So that's the end of our presentation today. I apologize. I did go 5 minutes over, but I appreciate you guys sticking around. Did anybody have any questions? And please feel free to unmute. I'm going to take a glance at the chat. I don't see anything in the chat. Right, and I don't see any hands up. So, okay, well, I want to thank you guys again for coming today. This is a great topic. We could talk about it a lot. We already did that, right? Been there, done that during COVID. But I'm glad that we had a chance to go through it again today, just as a refresher. Remember, you can always reach out to me or Nellie if you have any questions, concerns, comments, and we'll try to get back to you as soon as we can with the answers. So I hope you all have a wonderful day, and thanks.